Hey guys, this is Jeff from Men Physical Therapy, and what we're going to be talking about today is how we can tease out stability versus mobility for the lumbar spine. And I'm going to have Michael face this direction here. And as Michael bends forward, of course we're going to look at the quality of the motion and the quantity of the motion. But go ahead and try to do a forward bend. And if it's limited or painful, we can think about different mobility issues that patient may have. Maybe the lumbar spine, maybe the pelvis, maybe the hip, or the thoracic spine. And back up. But if it is limited in the motion, we can try to facilitate the muscles that would incorporate that work, especially the posterior chain that works eccentrically with that motion. So what you can do, tease that mobility versus stability issue out, is use the strap to have him push into the strap and try the same forward bend. If we give him a little help, does that improve the quality or quantity of the motion? And then back up. And if the motion improves, you can think it's probably less of a mobility issue and it's more of that stability issue for the spine. Now conversely, we can also check the backward bend. So with his hands on his hips, we'll try lumbar extension. And then thinking about what are all the mobility needs for this patient as he bends backwards and back up. And of course a PA would be appropriate back here, a manipulation. But we can also think about the anterior chain muscles that have to lengthen and work eccentrically to improve that motion. So I'm going to give him a little bit of support. If he kind of pulls into the strap and I give him an isometric contraction, he can recheck his extension. And again, if that improves, we're thinking it's more of a stability issue. And come back up. If it's exactly the same, we think it's more of that mobility issue. And maybe your first intervention is going to be towards the spine versus the motor control patient. Right. One last example would be, I'll turn face the door there, is side bending. So if side bending to the left is limited, we know that the right side benders are working eccentrically and back up. And if you feel any limitation in the motion, let's facilitate those hip abductors as well as the side benders. Have them tip over. And again, if it improves, we're thinking it's more of a stability patient. Come back up. And motor control is more appropriate on day one versus that mobility. Great. Thank you.